There's a couple rushing to the hospital due to the wife going into labor much earlier than expected. They're very excited but nervous. How could this happen so early? She still has a few weeks left. After the birth, they're patiently waiting to see their child. But then the doctor comes in and says the child is having a very hard time breathing. This is one of the many complications that can arise from a preterm birth. Today, I'm going to talk about one of them, neonatal respiratory distress syndrome. Neonatal respiratory distress syndrome, or NRDS as its acronym, is a medical condition that commonly affects preterm infants. You may be wondering how this is relevant to you. Well, if you ever plan to have a family in the future, your infant could be affected by this. So, neonatal respiratory distress syndrome affects the body through the lungs. Lung function and components will determine how neonates are affected by NRDS. The lungs are vital for various functions such as metabolism, secretion of substances including mucus and surfactant, and filtering of undesirable materials. But their main function is gas exchange to enable blood oxygenation and removal of carbon dioxide. This is a quote from Antonio Copel, a past graduate student of Akron who conducted research on neonatal respiratory distress syndrome. Neonate or neonatal means a newborn child, and surfactant is a water-like substance that is composed of lipids, fats, and proteins that aids in breathing function. There are two zones of the lungs, the conducting zone and the respiratory zone. The conducting zone is basically just airways or passageways that air passes through. The respiratory zone is where gas exchange happens and where the breathing is important, and that's what we're going to focus on. The development of the lungs affects how lung function gets carried out. Alan Joby from the book of Fetal and Neonatal Lung Development said, pulmonary abnormalities that arise as a result of preterm birth are typically due to underdeveloped alveoli and or vascular structures and have immediate detrimental effects at birth. This is why neonates, especially preterm infants, are affected by NRDS because of the underdevelopment of their lungs. 1 in 10 babies were born too early in the United States in 2020, according to the Centers for Disease Control and Prevention. This is around a 10% preterm birth rate. So what is respiratory distress? Marcel Filoche, a professor from the University of Paris, stated that labored breathing and poor oxygenation is called neonatal respiratory distress syndrome. So basically, when you're having a hard time breathing, you're in respiratory distress. As stated earlier, preterm infants often have their alveoli underdeveloped due to them not going through the full development period in the womb. Alveoli produce surfactant, which aids in respiration or breathing. From Lars Knudsen, a professor from Hanover Medical School, the alveoli are mechanically stabilized by surfactant in the lung's connective tissue backbone. So alveoli are these little sacs that sit in the respiratory zone. And the surfactant is important because it helps the surface tension of this little bubble. You want it to stay inflated to have as much oxygen as possible in there. Surfactant production occurs naturally in the alveoli from alveolar cells. This lowers that surface tension of this interface in the respiratory zone. So it's called air-liquid interface because it's where air comes into the lungs, reaches the respiratory zone, and then the liquid is your blood, which is on the other side of the alveoli. Carbon dioxide comes up from the blood, exhales out, and oxygen goes in from the lungs into the blood. And this is what helps your body function and do out its normal function. So if you can't breathe enough oxygen, your body will start to shut down and you could eventually die. The lack of surfactant is what causes neonatal respiratory distress syndrome. So without the cells producing surfactant naturally, due to the underdevelopment of the neonate's lungs, the surface tension of that little alveoli becomes very high, and this can lead to alveolar collapse. So this makes this circle very small. That means less oxygen can be in this space. So this increases breathing, which makes breathing very hard because they'll be breathing over and over and not get enough oxygen into their body. NRDS affects over 10% of the 60,000 plus preterm infants born every year, according to Robert Notter from his article, Lung Surfactant in an Era of Replacement Therapy. So, surfactant replacement therapy is used to combat NRDS. Replacing the natural surfactant with extracted surfactant moderates this respiratory distress that is occurring. Surfactant replacement therapy, or SRT as its acronym, is used to replace the deficiency of surfactant with extracted surfactant. Extracted surfactant is from calf or bovine lungs, so these are animals. They usually prefer animal-derived surfactant over a surfactant that could be made up in a lab, because in the lab, trying to produce synthetic surfactant, it's very hard to replicate the proteins that our body produces naturally. So, surfactant is instilled into the lungs through a tube called the endotracheal tube. And this goes in the trachea of the infant, which is the first branch of our lungs. The surfactant is instilled usually through a syringe by the medical staff, and once it's in the lungs, then they ventilate the infant, usually mechanically. So this means they usually have a mask on their face and they do the breathing motion with the airbag. This allows the surfactant to reach that respiratory zone, the alveoli, and raise that surface tension again, because now surfactant is present. This allows for more oxygen to go into the lungs, expanding that alveoli, and enables the neonate to go back to regular breathing function. In conclusion, the underdevelopment of preterm infants' lungs can cause neonatal respiratory distress syndrome due to the lack of surfactant production there. Using surfactant replacement therapy, neonates can achieve normal breathing by instilling extracted surfactant into the lungs. This is why surfactant replacement therapy is vital to premature infants who suffer from NRDS, because it lessens the mortality rates of affected patients and aids in preventing secondary diseases.